Hi everyone, welcome back to the fourth week of CBT class. Today you will learn how to structure your very first CBT session and also second session and beyond. So let's begin. So you've learned that one of the core principles of CBT is that CBT is structured. So why do we structure our sessions? Because first of all, it's important to make the therapy process understandable to your clients and also set expectations that your client needs to know what to expect when they come to session. And also for the purpose of efficiency and accountability, having that checklist either on paper or in your mind helps you to make sure that you are actually covering the important stuff that needs to be covered in therapy. So things that are important to cover in your first CBT session is that, first of all, you want to establish trust and rapport to build your therapeutic alliance with your client and normalize their current situation and instill hope. Like I said before, your clients might have been in therapy for years and years, and then they might not really expect that things might be different. So it's important for you to find ways to help your clients to still, stay hopeful that you can actually help out with the problems that they bring in. Another important thing to cover in your first CBT session is to educate your clients. So first of all, we're going to do psychoeducation about your client's diagnosis, and then we'll also educate your clients about the cognitive model as we have learned so far. And also we're going to orient your clients to the CBT process. Next, you want to collect some additional data. You've already spent 60 to 90 minutes to collect all the comprehensive information about your clients in the evaluation session, but there might be some information that you forgot to ask. Your clients didn't mention, but information that's important for you to know to continue to develop your cognitive conceptualization of your client. And based on all that information that you gathered through the evaluation session and that additional data you collected in the first session, you're going to develop a tentative list of goals that you're going to be working on. Again, this list of goals will be tentative because it'll continue to evolve as you revise your cognitive conceptualization as you get to know your clients better. And then lastly, depending on your client's readiness, how quickly your clients gets oriented to CBT, you can start problem solving in the first session, and I'll talk more about that later. So how do you structure the first CBT session? First of all, you're gonna set agenda. And when you set agenda, because this is the very first time that you're actually orienting your clients to CBT, this is where you're going to be a little more directive than how you would set agenda in upcoming sessions, because you will explain how you're gonna how typically CBT session is structured in this first session. And after you set agenda, you're going to do a mood check. And then there are different ways that you could do this depending on your client's developmental stage. One way that you could do a mood check is to use a standardized assessment such as Beck depression or anxiety inventories, which I uploaded to last week's module. But you can you can choose your own form, or your agency might have standardized forms that they use for a mood check. So this is an example of how you would introduce this standardized scales to your clients. I like to fill out these scales because I want to make sure as time goes on that treatment is working and you're making progress. So this is one way for us to kind of track your progress throughout different phases of therapy. You can also make it a little less formal by using an individualized scale. For example, you could just ask your client to rate the level of depression or anxiety that they experienced in the past week on a scale from 0 to 10 or a scale from 0% to 100%. So, you could just ask on a scale from 0 to 10, how anxious did you feel? 10 being the most extremely anxious and 0 being not anxious at all. You can also just make it really informal and then just ask the question like, how could you give me a broad overview of how you've been feeling in a sentence or two? So that's a perfectly fine way to do a mood check. When working with kids, you can use these feelings charts so that they could just point to the faces that reflect how they feel in the moment. You can also use these feelings thermometers so that kids can rate the level of distress that they're experiencing in the moment. There are lots of different charts, visual aids that you can find online, so feel free to just go to Google and then search for feelings thermometer or feelings charts. I've also used online mood checkers. This is an example of a website that I've used before with teens, which is called moodtracker.com. So you could actually enter a new mood record every day, and then it'll actually show you this graph based on the history of your mood. So you could enter your anxiety level, your depression level, irritability, and also the hours of sleep that you had each day, and if you take medication. You can also document whether you took medication or not. So you could actually make it a routine kind of in the beginning of the session. You can have your teen client to sign up for this website, and then they could actually show you to kind of discuss how they've been feeling in the past week. And this has worked well with me when working with teenagers. So after you set agendas and then do a mood check, you want to obtain some updates since the evaluation session, what happened to the clients, and then you want to discuss client's diagnosis and then do some psychoeducation around that diagnosis. Another important thing that you could do if you couldn't do this in the evaluation session. I mentioned this in my lecture around the CBT evaluation session, how important it is for you to get a sense of how your clients spend their time on a day-to-day basis. So if you didn't have time to do that in the evaluation session, you can do this in your first CBT session. And then another important thing that you could do is to elicit clients' core values. The reason why this is important is that a lot of times, these values, something that's really important to your client, it could be families, or that could be their work, or their, volunteer work, whatever they really value in their life, because that can be a source of motivation in inspiration for your clients to keep on going and stay well and healthy. So this will be important kind of strength that you will continue to refer back to throughout the therapy. So it'll be helpful for you to explore that in the beginning of therapy. So now we covered the beginning part of the first session. Once you get to the middle part, this is when you will get to identifying problems and set treatment goals. Again, at this point, your treatment goals will be still pretty tentative. So you will just share that with your client, and then let them know that that you will continue revising those treatment goals according to client's feedback as you get to know the client a little better. And then when you do this, your clients might actually bring up some of the like behavioral or emotional, physiological issues that directly impact their functioning in their daily activities. And you can kind of use that to educate your clients about the cognitive model. And then as you further discuss that particular problem. So at the end of the first session, you'll provide a summary of what you worked on, and you will review the homework. We'll actually spend some time to learn about how to assign and review homework in CBT. We have a separate class that we're gonna focus on that topic later. But homework is really integral to CBT. You will have homework assigned like almost every session, and you will start every session by reviewing homework. At the end, after you provide a summary of what you worked on, it's really important that you actually review the homework so that your clients have a clear understanding of what they're going to be working on throughout the week. And also they have the tools necessary to complete that homework. So we'll actually talk more about this when we get to that class where we'll focus on the homework part. And then also elicit feedback from your clients at the end, because particularly after this like first session, you will start developing some sense of like how your client is adjusting to this new therapy structure. And because CBT is very collaborative and then client needs to be really active participant, you really want to make sure that client is happy with how therapy is going. So it's important that you elicit feedback in every session. So you've learned how to structure your first CBT session, and for a second session and beyond, you're actually keeping very similar structure. So you're going to start with the mood check, and then you are going to make a bridge from the past week's session to this week's session. The reason that you're doing that is because you want to make sure that your clients develop some sense of continuation. So it's not like your every session is kind of discrete and separate from other sessions, but everything kind of flows coherently from starting to the end, so that you are actually working toward those treatment goals that you've shared with your client. So how do you make a bridge? Basically, you're going to ask your clients what happened between last session and this session that I should know about. And it's possible that your clients might actually go on and on, like talking about what happened to them. So it is possible that you might actually need to interrupt your client. If you think that your clients really already kind of starts getting into talking about specific problems, you can sort of gently interrupt your client and say that, should we call this problem as a problem with my neighbor, and then add it to today's agenda. So you're kind of giving enough time for your clients to briefly sort of mention what's, what kind of problems that they had to deal with during the past week, but you're not really dwelling in that, so that you can actually cover, the problems that has more priority. And then it is possible, especially if your clients are severely depressed, that they will explain things from a very negative perspective. So while you're actually listening to your clients, again, going back to what I said in the beginning, that it's always important to emphasize some positives, right? So you can ask these questions. When did you feel even a little bit better this week? If your clients, things really had been bad, like it's been really horrible, you can ask these questions so that your clients can kind of shift their mood a little bit while they're talking about what happened to them, and what positive things happened. And then another way that you can sort of wrap up this making a bridge thing is to ask your clients, what's coming up between this and the next session that I should know about? So there might be some like big test that's coming up, and if your client is has a problem with anxiety, they might be really preoccupied and like really worrying about what they're going to do. Like, I'm going to be so anxious. So you want to make sure that you're, whatever that your clients kind of feels really dreadful about, things that are coming up. Like, you want to make sure that you are actually working with them to prepare to handle, these triggering situations. So while you're making that bridge, you've heard about things happened in the past week. You've heard about things that will, will be coming up in the following week. So you've sort of prioritized what would be the major things that your clients really needs to work on during this session. So you can collaborate with your client to set agenda for that day. And after that, you want to review homework. Again, I'm going to emphasize this when we learn more specifically about homework in the context of CBT. But it's really, really important that once you assign homework, that you actually review that homework and then make it routine part of your session. I have an action plan, which is a term that is often used interchangeably in CBT to refer to homework. People used to call it homework, but homework, like who likes to do homework? Some people, they have very negative kind of automatic thoughts that are associated with the term homework. So it's actually encouraged that, Dr. Begg encouraged that you actually use the term action plan, because, that feels more helpful. It's more kind of desirable. It's something that you're being proactive to work on things. It just has a more positive connotation. So you can ask these questions to review homework, like what did you get done? So these are, I know, looking at your therapy note, you can kind of talk about, okay, these are lists of things that you said you're going to work on during the week. What are some of the things that you were able to accomplish? And what did you learn from that? Like, is there anything that you've done this week that would be helpful for you to continue doing? So that's the kind of questions that you'll be asking to review homework. And then you will prioritize the agenda that day. Maybe your clients had hard time working on some components of the assignment. So to prepare your clients to better handle homework in the upcoming week, maybe that could be part of your agenda. So you have a lot of materials to kind of choose from at this point to set your agenda for today's session. Now you're done with the beginning part of the second session and beyond. So now you know what you're going to be working on in that session. So once you get to the middle part, you're going to work on specific problems that you identified collaboratively with your clients that the clients will benefit from working on in this session. And a lot of times that involves like teaching specific CBT skills. And after you work on specific skills, based on that experience, you will set new homework, new action plan. And if you have time, you can work on the second problem, but that's not really necessary. It really depends on the pace and the time that you have for the session. So working on specific problems in the middle part of your session begins, by you asking your clients, what problem or problems would you like my help in solving today? So before you ask that question, you can summarize some of the main things that your clients mentioned. While your client was explaining what happened to them during the past week that was sort of difficult for them, and then you also heard about what's coming up that your client needs to be prepared for, and you also heard some of the challenges or struggles that they had in trying to complete homework in the past week. So by that time you have a list of issues that's on your client's mind, right? So you can summarize that list and then you can ask your clients, so I hear that these are some of the things that's on your mind. What do you think is the most important thing for you to work on today? What problems do you want my help in solving today? So once you identify the specific problems that you're going to be working on, you will want to collect more data about that problem. You can just ask a lot of questions like, what are some of the common triggers for that problem? How often does that happen? What are some of the most difficult consequences of having that problem? How does that impact your client's functioning? Where does it happen? Who's involved in creating that situation? So collect as much data as possible. And then, after you hear these problems, you want to summarize that problem according to the cognitive model. Remember, really cognitive model is the fundamental kind of part of CBT. So whatever your problem, whatever problem your clients bring in, you want to interpret it in cognitive terms, right? So that problem itself may manifest in physiological or emotional or behavioral terms, but you always want to tie that with what's happening in their mind, in their cognitive dimension. So summarize the problem according to the cognitive model and decide collaboratively with your clients where to start working on the problem. And then once you decide the best intervention that you're going to use to address that problem, always try to provide a rationale for the first intervention that you're using. CBT, like I've been saying, it's a very specific form of treatment, so your clients may or may not be so familiar with some of the intervention that you're using. So you always want to make sure that your clients knows what to expect and then feels safe and comfortable to work with you. And then you implement your intervention. And then after you try that, you always assess how well it worked by eliciting feedback from your client. You will actually get to see the examples of this a lot of times when we actually get to the skills part. So don't worry if these things don't really make sense. At this point, just try to understand it more like conceptually, and then once we get to the skills part, we will actually break this down, and you will see therapists actually doing this thing to teach your client like certain CBT specific skills. And then like toward the end of semester, you should be actually ready to actually implement this thing on your own, and then record it for the final project. And when you work on specific problems in the middle part of your session, it's always important for you to always think of these problems in the context of this cognitive conceptualization that you developed based on your CBT evaluation in first session. I mentioned that you're going to continue refer back to the CCD throughout the entire phase of therapy, and the CCD will continue to evolve as you work through. So you're working on specific problems, you always want to tie that with the CCD. So how do you incorporate CCD in working on a specific problem in your regular session? As I previously mentioned, always start from the bottom because these reactions to triggers, this activating situation at the emotional or behavioral physiological levels, these are the problems that directly interfere with your client's daily functioning, right? So if you've identified emotional problems, that maybe you will teach like emotion regulation skills, and then that will be a specific problem that you are working on. If you've identified behavioral problems, you can teach some behavioral skills. If you identify some physiological problem as the priority, then you can teach them like relaxation skills, right? And then, always, going back to that cognitive model, your goal is to always tie these more superficial level reactions with the thinking that's going on in their minds in triggering situations, right? So you will address, you will help your clients to identify their automatic thoughts and evaluate their automatic thoughts, and help your clients to respond in more helpful and adaptive ways to manage these problems that they deal with. So in the beginning of your therapy, you will be doing a lot of these things in that middle part of your session. Once you get to the middle part of middle phase of therapy, you have a better understanding of your clients' kind of deep-seated core beliefs, and then how that's kind of translated as all these unhelpful roles and assumptions and attitudes. So you can start addressing those intermediate and core beliefs once you get to the middle phase of the therapy. And then at the end, the final phase of therapy, your all these skills that you worked on, you will actually help your clients to keep practicing and master those skills so that they could actually use it outside of therapy, and then prepare your clients for termination. So that's what will happen in the final phase of therapy. So after you worked on like specific problems in the middle part of the session, at the end of the session, we're going to do some things that are very similar that you did at the end of the first CBT session, which is like providing the summary of what you worked on, and then reviewing the new assignment that you're going to give to your clients to work on during the upcoming week. And always elicit feedback from your clients so that you can adjust your session the way it works better for your clients. So to wrap up, today you learned about how you can structure your first CBT session and also second session and beyond. So you learned about different components in each session, in the beginning, in middle, and the end of session. Also, you learned about how you can work on specific problems using the cognitive conceptualization diagram throughout the beginning and middle and final phase of your therapy. So this other video that you're going to watch during this week, there is a lot more comprehensive information about structuring CBT session, and you'll also get to see some examples of watching therapists actually using these components to structure their session. So I hope that's helpful for you. And that's it for today. I'll see you next week. Bye.